In this section, we're going to look at the muscles of the back and chest, how they're organized, where they attach, and what they do. We'll divide them into deep versus superficial muscles of the back, and then we'll move into the superficial muscles of the chest. You'll see how some of these muscles work directly on the vertebral column, keeping us upright, while others connect the axial skeleton to the appendicular skeleton, moving the arms and shoulders. By the end, you'll know not just their names, but their actions, innervations, and how they work together in movement. There are 3 muscle tissue types. Skeletal muscle is voluntary, striated, multinucleated, and attaches to bone. It's what we think of when we work out. Cardiac muscle is involuntary, striated, and has intercalated discs. It's only in the heart. Smooth muscle is involuntary and non-striated, lining organs and blood vessels. The big difference is voluntary versus involuntary control, and whether they're striated or not. Muscles of the back can be grouped into 2 categories: deep intrinsic muscles and superficial extrinsic muscles. Deep muscles grow in place, attach axial skeleton to axial skeleton, and move the back and skull. They're innervated by the dorsal rami nerves. Superficial muscles migrate in, attach axial to appendicular, and move the upper limb by acting on the scapula or humerus. These are innervated by the ventral rami nerves. Think of it as 2 teams, one stabilizing the spine itself and the other moving the limbs. The 3 deep muscle groups to know are the Erector Spinae, Transversospinalis, and Splenius. Each is really a group of smaller muscles, but for our purposes, we learn them by their group names. They all help stabilize and move the vertebral column, and all are innervated by dorsal rami nerves. Erector Spinae runs from the iliac crest up through the cervical vertebra, attaching along the way. It doesn't have a single origin and insertion, but instead spans many vertebrae. Its action is to extend the vertebral column, keeping us standing upright. When only one side contracts, it bends the trunk laterally. Innervation is dorsal rami nerves. Think of this group as the body's scaffolding that holds you erect. Splenius runs from the cervical vertebra up to the skull. When both sides contract, they stabilize the cervical spine and hyperextend the head. When one side contracts, they rotate and bend the head. Innervation is dorsal rami nerves. Splenius means bandage. Think of these muscles as bandages wrapping the neck. The transversospinalis group of muscles runs from transverse process to spinous process of the vertebrae. They create slight rotation and bending movements of the spine. They're small but important stabilizers, especially in posture. Innervated by the dorsal rami nerves. These are the fine-tuning muscles of the back. The four superficial muscles of the back are trapezius, rhomboids, levator scapulae, and latissimus dorsi. They're all extrinsic, attaching axioskeleton to appendicular bones. Their job is to move the scapula or humerus, and they're innervated by the ventral rami nerves. Trapezius originates from the vertebral column and the back of the skull and inserts onto the spine of the scapula. Its actions include shrugging the shoulders, depressing the scapula, and retracting the scapula. Innervation, ventral rami nerves. It's the large diamond-shaped muscle across the upper back. Levator Scapulae originates from the cervical vertebrae and inserts on the superior angle of the scapula. Its job is to raise the scapula, working as a synergist to trapezius. Innervation, ventral rami nerves. Think of it as the elevator for your shoulder blade. Rhomboids attach from the vertebral column to the medial border of the scapula. Their action is to retract the scapula, pulling it medially toward the spine. They also synergize with trapezius. Innervation, ventral rami nerves. When you pinch your shoulder blades together, that's rhomboids at work. The latissimus dorsi originates from the iliac crest and sacrum and inserts into the floor of the intertrabecular groove of the humerus. Its action is to extend or hyperextend the shoulder, basically pulling the arm back. It's innervated by the ventral rami nerves. This is your big pulling muscle, important in climbing, swimming, and pulling actions. Superficial chest muscles attach the axial skeleton to the appendicular skeleton and move the upper limb. Their actions focus on the scapula and the humerus. They're innervated by the ventral rami nerves. Deep chest muscles will cover with respiration, so here we'll stick to the superficial ones. Serratus Anterior originates from ribs 1 through 8 and inserts on the anterior surface of the scapula's vertebral border. Its action is to protract and hold the scapula against the ribs, and it rotates the scapula to raise the arm. This is the boxer's muscle, key in punching and pushing. Innervation, ventral rami nerves. Pectoralis Major originates from the ribs, sternum, and clavicle, and inserts on the greater tubercle of the humerus. Its action is to adduct and medially rotate the shoulder. It's a powerful chest muscle for bringing the arm inward. Innervation, ventral rami nerves. Pectoralis Minor lies deep to the Pectoralis Major. It originates on the ribs and inserts on the coracoid process of the scapula. Its action is to draw the scapula forward or to lift the ribs superiorly. Innervation, ventral rami nerves. Think of it as a stabilizer and adjuster for scapular movement.